Michael suffers from bipolar disorder, a mental health condition where patients suffer from both episodes of mania and depression. But he's also one of the 4.6 million people in England who, alongside their mental health problem, struggle with a long-term physical illness. Because of his diabetes, Michael has to inject himself with insulin 4 times a day to manage his blood sugar levels. He says coping with both types of condition can be more difficult.
If there's something that's not quite right, and then you've got something else that's not quite right, then it makes it a mess. And if you can't cope with it or deal with it, you struggle. And I struggled for a lot of time.
In England, 15 million people suffer from a long-term physical condition. Not all of them will develop a mental health illness, but they are at a higher risk.
Sometimes it's depression, which is the first, and sometimes it's diabetes. But in both instances, it's considerably more frequent than in the normal population. People with diabetes will have maybe twice as frequently depression as people who do not have diabetes. And the same is true for people with depression.
Michael explains that his bipolar can get in the way of keeping his diabetes under control.
There was a time, probably a year ago now, that I didn't take care of what I ate. I didn't look after myself. I think there are connections that if I'm feeling quite fed up, then I'll just have like a microwave meal, for the easiest. So, there's times when I've really got to force myself to eat healthy, yeah.
The fact that you have a mental health condition as well as your physical health condition impacts on everything to do with the detection, the treatment, the success of the treatment and the outcome of the treatment for that physical health condition.
Every week, Michael has to collect his medication from a local pharmacy. But some weeks, his mental illness leaves him feeling so low he can't even leave the house.
The confidence is a big thing, and sort of socialising. Yeah, it's just it's because it's about moods and personalities. I think that's the big thing where. Because if you're on your own, then you don't have to talk to anybody. Just me and cats, you can potter about. But sometimes you can struggle to answer the door to the postman. It's crazy.
Comorbid conditions, that is 2 illnesses occurring in a patient at the same time, is costing the NHS billions of pounds each year.
We've estimated roughly about £6 billion a year is spent extra on the NHS for comorbidity of mental health conditions on top of chronic physical conditions. If you've got diabetes, for example, and you have quite severe depression, then what we find is that all too often people don't do the self-care management of their diabetes. They forget to take their insulin, they forget to take their medication. Therefore you get terribly ill and you're in and out of hospital being treated for physical symptoms of diabetes.
Though the link between our mental and physical health has been well researched by academics, it is still a new concept for healthcare. We asked Professor Prince why comorbid illnesses aren't always tackled effectively.
Training in mental health is often very brief. For health professionals, it's often a very compartmentalised part of their training, so people see it as separate and other, as opposed to properly integrated and relevant to almost every aspect of their daily work.
GPs and health professionals are more than capable of treating those with mental illnesses, but comorbid care has repeatedly been neglected from government health policy. The Department of Health was supposed to publish the government strategy to integrate mental and physical health care in December 2012, but if you have a look on the website, as you can see, no such report has been published. Rita was diagnosed with bipolar disorder 7 years ago. Having always been extremely fit, she has found it hard to maintain her physical health whilst being on medication.
The biggest thing is weight gain. I take a few types of medication. Some are worse than others. But I've got a really active lifestyle. I do lots of sports. I'm a very healthy eating, but I still struggle to maintain my weight.
Rita works for a bipolar research centre called Spectrum. She believes that psychiatrists can spend so much time on a patient's mental health that they treat the physical side as secondary.
The psychiatrist I had before, and I changed deliberately, was because he'd actually said to me, look, you should be thankful that we're keeping you well. And at first I was, because I'd been so poorly, but after a while I was thinking, is this it? Is this going to be my life, where I can do little? I used to run marathons and swim, mile swims, and have I got to change just because I'm swallowing certain medications, certain pills?
Rita isn't alone in thinking more can be done to combine both types of care.
If the health system were to organize itself in a manner that would allow the simultaneous approach to these various diseases, life would be much better for everybody.
We contacted the Care Minister, Norman Lamb, who provided us with a statement. He said, "I am committed to working with the NHS to deliver joined-up services that put people first, so they don't have to knock on several doors to get all the care they need. I want to make sure that mental health has equal priority with physical health, and our mandate to NHS England makes improving mental health and treating mental illness a key priority for the new board." We also spoke to the chair and vice chair of the All-Party Group for Mental Health. They told us why they thought the government has been so slow to react.
I'm surprised really it's taken us so long at Westminster to fully understand the implications of mental health on physical health, but also physical health on mental health. The worry is that perhaps something as groundbreaking in many ways as this may be making people in the Treasury nervous.
Politicians have wanted to tread cautiously around mental health. They felt uncomfortable talking about it. There is a desire to get it right, but we're starting from a very low point, so it's going to take quite a lot of time to get there.
For the experts we've spoken to, breaking down the barriers between mental and physical healthcare is an essential step forward for 21st century medicine. Not only will it save the NHS billions of pounds each year, it will also change the lives of people like Michael and Rita.